a couple days ago, I heard on the radio that the cost of family health care has gone up 80% just this decade alone. And part of the problem is that people have to understand and deal with changes to an amorphous system that no one really understands, and those changes are just very inefficient and they cause rising costs. And that's where IT can really come in. Information technology can open up the transparency of medical informatics and healthcare systems so that people can understand what is involved in healthcare. They can make better decisions and take ownership of their own situation. That's going to be a key element, I think, in future systems as we move forward. And what that means in terms of IT is that we need systems that enable that to be done, that present the information, allow it to be efficiently stored and queried, keep that information secure so that people have confidence that their proprietary data will not be shared. And IT plays a fundamental role in all those aspects. We have to discuss possible ways of delivering health care and what those ramifications and opportunities are. So that could involve health information centers. It could involve new kinds of clinics that are set up in non-traditional locations. It could involve telemedicine and also home health care and how you can monitor and treat people while at home. And IT is a principal part of all of those areas. The other key area is just one dealing with consumer choices. To have the ability to make informed decisions, you have to have reliable and hard data. That involves also educating people who may not all have the same IT skills and ability to access and use that data. So there's a large educational component that's involved in really realizing IT, plus making the tools capable to provide the necessary data for consumers. Personalized medicine brings in the whole area of bioinformatics and genetics, namely how do you use the DNA characteristics of a patient in order to design the best treatment or prevention. It's a critical issue in terms of pharmacies and trying to give the right drugs to patients because we want to tune the drug to the actual patient, and that's a key area. Another very important area is healthcare informatics and keeping the right records, and that's an area that brings in security in a major way. Plus, we want to be able to analyze the information across the broad spectrum of consumers in order to understand the best way to deliver healthcare, but we want to do that and preserve the privacy of individual patients. That's an area actually where we have a lot of expertise here at Purdue in doing exactly that. How can we adequately preserve the privacy and provably protect confidentiality, but yet still be able to extract meaningful data from a population? Fundamental challenge is education, because as we develop IT techniques for patients to make better decisions, we have to give everyone the ability to really understand what the data present and how they can use them effectively. And not all people have the same backgrounds, and therefore we need to really aggressively provide educational opportunities. Also, just enabling systems that allow people to own their data and take responsibility for them, I think, is key. For that to have real impact in society, we have to have systems that people can reliably count on as being secure, because people do not want their medical information to be leaked out or made public. And right now we just don't have IT systems that do that. We don't have a standardized approach, and that's a challenge in the industry. Well, you're now seeing several companies developing healthcare systems in order to enable this kind of informed consumerism, where patients and consumers have control of their own data and can use that to make decisions. And that involves a lot of these issues of how to store, allow access, share, and do that in a confidential way. So that's becoming a major effort in many companies.